of how you hire your aides and how they're trained.
Okay, yeah, and I do think that's one of the ways that we kind of stand out from other companies. So our HR recruiter, her name is Rhonda. She was actually a caregiver with us for about 9 years before she took the HR position. So with her experience, she's really good at finding good quality caregivers. She knows what it takes, knows what we are looking for. Um, and so once she's hired them on, then they actually come sit with me for their skills test and skills training. Um, uh, we are considered a non-medical company. Well, a lot of non-medical companies out there, they don't really dive into the medical side at all. However, we do. We want our caregivers to kind of be prepared for some of the situations that they might come across in the home. So when they sit with me, we go over, the normal things like ambulating people and bathing people and things like that. But we also go into some diagnosis specific stuff. So we talk about, what are you going to do if you have an Alzheimer's client who gets combative or aggressive? The proper ways to handle that. Or if, your client has a seizure while you're with them, what actions you need to take to make sure that they're safe and they don't hurt themselves. We talk about diabetes and low sugars. We talk about the signs and symptoms for stroke and heart attack. And of course, how to take care of them after they've had a stroke and help with that learning process as they're learning, to function in a totally different environment. So we really try to prepare them for some of those scenarios they might come across. Even things like all of our caregivers are CPR certified, but one of the things that they don't teach you in your CPR class is what if your client is in a wheelchair and they've gone into cardiac arrest? You need to know how to get them out of that wheelchair safely without injuring them or injuring yourself. So those are just some of the things that we cover so that hopefully when they come across some of these emergency situations,